Welcome, everyone, to Vet and Tech webinar series. I'm Jennifer DeBran, and I will be your host. Vet and Tech webinar series is the exciting new way to enhance your clinical skills and gain RACE approved CE credits. If you'd like to stay up to date with all of our webinars and vet courses, download our mobile app, Vet and Tech today. Dr. Reno, welcome. Hi, thank you very much for joining us this evening.
Hi, great to be here.
Wonderful. So most of our attendees have been watching us for a few years, and some of the fun facts that we love to share typically come from our guest speaker. So do you have a fun fact that you would mind sharing with the audience?
I guess I should probably talk about the Breathe Clinic, which many of you have probably never heard of respiratory and aerodigestive clinics. I think our clinic is the first in the world that is a branch off our internal medicine service. And my colleague and I founded it so that we could provide unique and very high quality care for patients with both respiratory problems as well as what we call aerodigestive diseases. And that's kind of where breathing and swallowing disorders overlap. So I'm going to be talking today about managing inflammatory airway disease in cats. And I think as clinicians, typically we tend to think primarily of what are called large airway diseases. And in this lecture, I'm going to compare and contrast that to small airway diseases, which many of you may not have heard of. So in terms of large airway disorders, this includes things such as allergic asthma, chronic bronchitis, and bronchiectasis. So diseases that primarily affect the larger airways greater than 2 millimeters in diameter, including bronchi and bronchioles. You'll notice on this list, I also include parasitic bronchitis, and that will include things like toxicaric cat eyes. It migrates through the lungs, Allergic abstrussus, another type of lungworm, and even heartworm-associated respiratory disease. So heartworm disease in cats actually manifests more commonly as a lungworm than it does as a true adult heartworm. The other thing that I have at the bottom of this list is secondary bacterial bronchitis, and that's really critical because the secondary bacterial infections imply that there is always an underlying problem. So unless you address the underlying issue, which in other words means you have to identify what that is, just giving repeated courses of antibiotic after antibiotic after antibiotic is going to do nothing to help to fix this underlying scenario. Now that we're thinking about large airway disease that is inflammatory, and we'll focus predominantly on asthma and chronic bronchitis, because these are the two most common that we'll see, how do we end up treating these? And there are many, many different things that we can do. This is kind of historically where we start, and that's often with environmental modulation. I'll talk about each of these in turn. Bronchodilators, and I want to get away from the potential misconception that any cat with inflammatory airway disease must have a bronchodilator. They have their place, and it's not in every scenario. We'll talk about that. Glucocorticoids, that is the mainstay of therapy. So at this time, the most important drug that you can give to a cat with inflammatory airway disease is a steroid. Weight management, we always have to focus on that. I think that's one of the things that we have been not emphasizing as much in our treatment plans. And then finally, if we identify secondary bacterial infection, we need to make sure we're addressing that appropriately. I will say it is relatively uncommon. So you should not think, oh, I've got a cat coming in, it's a new patient, it's got a cough. Owners don't have a lot of money. I need to do empiric therapy. I'm going to prescribe antibiotics. That's not going to work. You should not go down that pathway. Antibiotics are unlikely to fix the primary problem if you have a cat with chronic cough or chronic respiratory signs. It's always going to be a secondary infection, and you got to look for the primary underlying disorder. Now, what do we do if it's an unstable asthmatic cat? So we call that status asthmaticus. And sometimes in these cases, before we do a bunch of diagnostics, we want to keep them alive. So we may just empirically try therapy. You can do supplemental oxygen. You can just let them like chillax a little bit in a secluded environment. But before you do that, the single most important drugs that these cats must have is a bronchodilator. The reason they are trying to die is because of bronchospasm. My recommendation is you pop them with an injectable steroid that will have very good bioavailability and can start to work fairly quickly. Inhaled is another route. I recommend that if owners often have to give it before they can get into a veterinary clinic. The problem is cats can have such severe bronchospasm that when they're breathing in, they may not deliver it to their lower airways. So typically, if I'm going to do inhaled, I'll give them a couple of puffs of albuterol, let them breathe it in, give them another 10 or 15 minutes, go ahead and repeat that. And by that time, hopefully you had a little bit of bronchodilation. So the next round of medication will penetrate deeper into their airways. And you may even need to repeat that a third time. Oral bronchodilator is probably not going to act quickly enough. So in order to diagnose small airway disease, we have to rule out the other disease mimics. We're going to start off with radiography. We may do, multiple treatment trials, kind of treating for what we think is treatable. And ultimately, the cats are probably not going to respond. They will need referral to have a high quality thoracic CT scan. And then ultimately, some of these cases may end up needing a lung biopsy to get a definitive answer. Thoracic CT will give direct and indirect signs that point towards bronchiolar disorders. So if you have someone who has a high quality CT, they can say, I don't know what kind it is, but it absolutely seems like there is small airway disease in this cat.
This one comes from Mr. Weldon. Are there specific types of litter that you found that are really low dust? They all say low dust, but I haven't found a clumping litter that isn't dusty.
Yeah, I mean, I think it's hard in general to find the perfect cat litter. So usually what I'm actually more focused on is finding something that doesn't have a lot of silicates in it. So you're trying to prevent things that have a particulate size that when they inhale it is going to go deep into their lungs, often to their small airways. The two that I typically recommend, one is called Yesterday's News. It's a newspaper-based cat litter. And as you can imagine, there are many cats that prefer the luscious feel when they're kind of going in their litter box of more of something sandy. So it takes them a while to acclimate to that. And some cats just won't tolerate it. If you use that, go ahead and transition slowly to it so that they do kind of acclimate. The other one that I recommend is Oko Cat, OKO Cat. They're often plant-based litters.